the United States, approximately 37 million individuals are diagnosed with diabetes, a chronic condition characterized by elevated blood sugar levels. Effectively managing this condition is paramount, and regular testing plays a pivotal role. In this video, we will explore 7 essential diabetes tests that you should incorporate into your routine. These tests offer important insights into your health, enabling you to make informed decisions and collaborate effectively with your healthcare provider. Wait till you hear about the fasting blood glucose test. 1. Fasting blood glucose test. The fasting blood glucose test is a crucial measurement tool that requires you to abstain from food and beverages, except water, for a minimum of 8 hours before the test. This abstinence helps healthcare providers establish a baseline blood sugar level, unaffected by recent food intake. As diet significantly influences blood sugar levels, this test provides valuable insights into how your body regulates blood sugar in a fasting state. The results of a fasting blood glucose test are measured in milligrams per deciliter. A result of less than 100 milligrams per deciliter is considered within the typical range, while a result between 100 and 125 milligrams per deciliter indicates prediabetes. A result of 126 milligrams per deciliter or higher, when confirmed by a repeat test, is indicative of diabetes. This test is particularly important as it helps in the early detection of diabetes, allowing for timely intervention and management. Individuals with prediabetes, characterized by blood sugar levels higher than normal but not yet in the diabetic range, are at an increased risk of developing type 2 diabetes. According to the Centers for Disease Control and Prevention, 84 million adults in the United States have prediabetes. Regular monitoring through fasting blood glucose tests can help these individuals make necessary lifestyle changes to prevent or delay the onset of type 2 diabetes. 2. Random blood glucose test. The random blood glucose test, unlike the fasting blood glucose test, can be conducted at any time of the day, regardless of when you last ate. This test is particularly useful for individuals experiencing severe symptoms of hyperglycemia, such as increased thirst, frequent urination, and unexplained fatigue. It provides a snapshot of your blood sugar level at the moment, offering immediate insights into your glucose status. Similar to the fasting blood glucose test, the results of a random blood glucose test are measured in milligrams per deciliter, mg/dl, a blood sugar level of 200 milligrams per deciliter or higher, accompanied by classic symptoms of hyperglycemia or hyperglycemic crisis, indicates diabetes. This threshold is critical for diagnosis, as it reflects a level of glucose in the blood that is significantly elevated and potentially dangerous. Hyperglycemia, or high blood sugar, can occur due to various reasons, including insufficient insulin production, insulin resistance, or other underlying health conditions. It's important to note that a single high random blood glucose test result may not be sufficient for a diabetes diagnosis. Healthcare providers typically require confirmation through additional tests, such as a repeat fasting blood glucose test or an A1C test, to ensure accuracy. 3. A1C test. The A1C test, also known as the glycated hemoglobin test, is a vital tool for assessing long-term blood sugar control. This test provides an average of your blood glucose levels over the past 2 to 3 months, giving you and your healthcare provider a comprehensive view of your glucose management. Unlike the fasting and random blood glucose tests, which offer a snapshot of blood sugar at a specific time, the A1C test reflects your body's overall glucose control over an extended period. The results of the A1C test are expressed as a percentage. A result of less than 5.7% is considered within the typical range, indicating good blood sugar control. A result between 5.7 and 6.4% signifies prediabetes, suggesting an increased risk of developing diabetes. A result of 6.5% or higher, when confirmed by a repeat test, is indicative of diabetes. Maintaining an A1C level within the target range is crucial for individuals with diabetes, as it helps reduce the risk of long-term complications. These complications can include heart disease, nerve damage, kidney problems, eye damage, and other serious health issues. According to the American Diabetes Association, the general target A1C level for most adults with diabetes is less than 7%. However, individual target ranges may vary depending on factors such as age, other health conditions, and the specific type of diabetes. 4. Oral glucose tolerance test. The oral glucose tolerance test, OGTT, is primarily used to screen for and diagnose gestational diabetes, a type of diabetes that develops during pregnancy. This test is typically conducted between 24 and 28 weeks of gestation, as this is when hormonal changes can significantly impact blood sugar levels. The OGTT involve a series of blood sugar measurements taken at specific intervals after consuming a sugary drink. The test begins with a fasting blood glucose measurement, establishing a baseline. The pregnant individual then drinks a liquid containing a specific amount of glucose, usually 75 grams. Blood sugar levels are measured again at 1 hour, 2 hours, and sometimes 3 hours after consuming the drink. These measurements assess how the body processes its sugar over time, providing important insights into insulin resistance and glucose metabolism. The results of the OGTT are compared to established thresholds to determine if gestational diabetes is present. Gestational diabetes is diagnosed if any of the blood sugar levels meet or exceed the following criteria: a fasting blood sugar level of 92 milligrams per deciliter or higher, a 1-hour level of 180 milligrams per deciliter or higher, or a 2-hour level of 153 milligrams per deciliter or higher. Accurate diagnosis is crucial, as gestational diabetes can pose risks to both the mother and the developing baby. 5. Urine tests. Urine tests are a simple and non-invasive way to detect certain substances in the urine that may indicate diabetes or related complications. While urine tests are not used to diagnose diabetes, they can provide valuable information about your overall health and the effectiveness of your diabetes management plan. 2 common substances that urine tests can detect are glucose and ketones. Normally, glucose is not present in the urine. However, when blood sugar levels are consistently high, the kidneys may not be able to reabsorb all the glucose, leading to its presence in the urine. This condition, known as glucosuria, can be a sign of uncontrolled diabetes. However, it's important to note that glucosuria can also occur in individuals without diabetes, particularly during pregnancy. Ketones are byproducts of fat breakdown that occur when the body doesn't have enough insulin to use glucose for energy. The presence of ketones in the urine, known as ketonuria, can be a sign of a serious complication called diabetic ketoacidosis, DKA. DKA is a life-threatening condition that primarily affects individuals with type 1 diabetes, but can also occur in those with type 2 diabetes under certain circumstances. Symptoms of DKA include nausea, vomiting, abdominal pain, fruity-smelling breath, and rapid breathing. 6. Cholesterol test. A cholesterol test, also known as a lipid panel, measures the levels of different types of fats in your blood. These fats include total cholesterol, low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, high-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, and triglycerides. Maintaining healthy cholesterol levels is particularly important for individuals with diabetes, as they are at an increased risk of developing heart disease and stroke. Diabetes can affect cholesterol levels in several ways. High blood sugar levels can damage blood vessels, making them more susceptible to the buildup of plaque, which is composed of cholesterol and other substances. Additionally, diabetes can lower HDL cholesterol levels and raise triglyceride levels, both of which contribute to an increased risk of heart disease. The American Diabetes Association recommends that adults with diabetes have their cholesterol levels checked at least once a year, and more frequently if their levels are not within the target range or if they have other risk factors for heart disease. The target ranges for cholesterol levels in individuals with diabetes are generally more stringent than those for people without diabetes. For example, the target LDL cholesterol level for most adults with diabetes is less than 100 milligrams per deciliter, and in some cases, less than 70 milligrams per deciliter may be recommended. 7. Eye exam. Regular eye exams are an important part of diabetes care. Diabetes can affect the eyes in various ways, and if these problems are not detected and treated early, they can lead to vision loss and even blindness. The most common eye problem associated with diabetes is diabetic retinopathy. Diabetic retinopathy is a condition that damages the blood vessels in the retina, the light-sensitive tissue at the back of the eye. Over time, high blood sugar levels can weaken and block these blood vessels, causing them to leak fluid or bleed. In the early stages, diabetic retinopathy may not cause any symptoms. However, as it progresses, it can lead to blurred vision, floaters, dark spots, and even blindness. Individuals with diabetes are also at an increased risk of developing other eye conditions, such as cataracts and glaucoma. Cataracts are clouding of the natural lens of the eye, while glaucoma is a condition that damages the optic nerve, which connects the eye to the brain. Both cataracts and glaucoma can cause vision loss if left untreated. Incorporating these 7 essential diabetes tests into your routine is crucial for effectively managing your condition and minimizing the risk of complications. Regular monitoring, in collaboration with your healthcare provider, empowers you to make informed decisions about your treatment plan and lifestyle choices. By staying proactive and vigilant, you can maintain optimal health and well-being while living with diabetes. Remember, knowledge is power when it comes to managing diabetes. Make sure to like, respond to the question asked in the comment section, and subscribe. Also, make sure to watch this video to continue learning about diabetes.